Good morning, everyone. This is Diane Winbush. This is Women Who Rock Investigate. So today we will be doing a case study in monkeypox and also the latest variant that is mutating. And so before I got started, Dr. Sears and I were speaking about it, that it's this variant, these variants are here to stay. So, but we still want to be able to provide the information and knowledge to our audience so you can know how to take certain precautions. So first, we're going to go around the table and we're going to let each doctor bring an introduction to the audience of who they are in their practice. So good morning, Dr. Sears. And so we're going to start with you, and you share a little bit about you and what you do.
Okay, well, my area is really medical research. And so again, I'm more concerned about the biochemistry of what transpires with viral infection and what can one do to increase one's immune systems.
Okay, and Dr. Purdy?
Sure. So I'm Laura Purdy. I'm a family medicine physician, and I'm actually licensed in all 50 states. And so I do a lot of virtual health in patients across the country. And in the last couple of years, my input has really been with talking to the patients about what's going on, trying to help them sort through all the things that they are hearing and reading and know what's true and what's real, and helping them figure out what to do and what to look for and how to take care of themselves and their families.
Okay, perfect. So good morning, Dr. Raina. We're introducing ourselves to the panel and also to the audience. So we want to learn a little bit about you and your practice.
Good evening from India. It is a good morning in your part of the world, but for me, it's an evening time. I am a public health person. I work as professor and head of Department of Community Medicine at a medical college in northern part of India. So my primary concern is to look after what exactly is happening in terms of public health policy in my part of the country as well as India as a whole. And for last 2 years, I have been working in the field of COVID-19, how exactly it's panning out in India and what needs to be done to prevent the outcomes of this pandemic, as well as to be able to control whatever the outcome is. So that's what I do, what I have been doing for the last 2 years. Otherwise, I am basically a physician practitioner working in the area of public health.
Okay, perfect. So Dr. Purdy, we're going to start with you, and then after that, then we're going to get some information from Dr. Sears, because he deals with the internal organs as to how these different variants, these different diseases that individuals have, how it breaks down in our body system. So we're going to start with you, and for you to be able to share with the audience about the new variant that we have, which is the B4 and the B5. And so we know that they have all types of titles, names, and what have you. And so how is this one that is affected? Because we see in the latest breaking news that even after the people get the treatment, it's coming back.
Yes, you are correct. And so the way that I talk to patients and people about this is it's actually really similar to what we see with influenza. People know how to think about that, right? Like every year it's a different strain, and it's, the same virus, but it's slightly different. And so the vaccines are different. And just that whole concept is the way that I explain it to people. The B4 and the B5 are what we would call sub-variants of, as I understand it, to be the Omicron, which we saw earlier in the year, late last year. And so these are subvariants or mutations of that virus. And so that, I think that's part of what people are really wanting to know, right? And like you mentioned with, it comes back and then it goes away, and then you have different symptoms. The vaccine's less effective. It's because the virus is mutating, and each time that happens, people are going to be susceptible to catching it again because they don't have antibodies to that particular strain or variant that they might have been, they were exposed to a different one in the past.
Wow, that's something. Okay, so that's going to bring us to Dr. Sears. That's going to bring us to him as to, how does this break down? And you've been on the show, Dr. Sears, with us. I think this is your 5th time coming onto the show, sharing different elements of how this can break down, some of the body organs and what have you. So, and you also have a book that you have written about the zone. So talk to us a little bit about that as well.
Well, the thing about the virus is basically it's a generator of systemic inflammation. So even though we think of it as primarily attacking the lungs, it really basically has the ability to attack virtually every organ in the body.
Okay.
And for many, about 1/3 of those patients who are infected with the COVID virus, they get what is called long hauling. They basically have these what are called cytokine storms. They're not the robust ones that send you to the ICU, but you basically have essentially chronic fatigue syndrome for a significant period of time. And this happens to about 1/3 of the patients.
Oh, wow.
So what you're seeing with this virus is a virus that basically has a dramatic increase of inflammation in every organ in your body. And this is why that we have such a wide variety. But viruses tend to mutate with time, but become less virulent. So even though we have a great increase here of the new variants, they don't seem to be quite as virulent as the earlier ones.
Okay.
So I think we'll be seeing a consistent increase of mutations, as Dr. Purdy has shown out. But again, we will not have the spikes of mortality that we saw with the earlier outbreaks of the various earlier mutants.
Okay. So, Dr. Raina, in your practice in India, and of course you're a part of the World Health Network as well. So, what are some of the solutions that you all are coming up with there to be able to see what I guess how we could be able to get a grasp and a hold to these variants?
Look, probably the best way to reach out to tackle these pandemics is to inform people, is to tell people that look, we are still in the midst of the pandemic, and if we are thinking that if we have overcome it, it's the wrong thing to believe in. And whatever has worked in our favor for last 2 years, as far as this pandemic is concerned, continues to work. So if you tell people, look, these public health measures, whether this was use of masks in all public places, that needs to be stuck to, whether it was reducing the amount of travel that you do on the daily basis, that again needs to be stuck to, because that's how you actually reduce the number of cases. The fact is that even if Omicron or its variants at this point in time may not be causing a lot of fatality, the number of people who are hospitalized may be very less. But the overall number, the total number of patients who come to you is increasing. So you may have a huge number of people with you who may not actually fall sick, but have the potential of becoming sick, as well as creating more and more variants. As the number increases, the higher chance of the variants is there. So it's probably the best way is to deal with the numbers at this point in time, reduce the numbers, and the best way to tackle with numbers is to resort back to those public health practices of reduced travel, of using masks, taking care of all the public places, and that is probably improving ventilation. That is probably the key as far as this pandemic, even at this point in time, is concerned.
Mm-hmm. Absolutely. I'm going to be, I guess, a little redundant on the next statement that I'm going to make. So when I was growing up, there was a cemetery that was in the community. And for years, I know probably about 40 years, it's just had a small minimum amount of people. But today they had to buy some more property because of so many people have died due to the Omicron. I'm just being honest. 40 years. Now, all of a sudden, they had to purchase some more property in order to put more people into, I mean, it's kind of, sad a little bit. So I do feel that, as what Dr. Raina said, we have to continue to talk about it. I think people are kind of pushing it up under the ground. Nobody wants to talk about it anymore. Even with, I think the White House had a function not too long ago, maybe about a month or two ago, and some of those individuals was affected, with the variants and what have you. So this question is going to be for Dr. Purdy. What would you suggest in regards to traveling? It's hot. Everybody's going to the beach. Everybody wants to travel. This is the travel season for everyone. So what are some of the precautions that people should be taking, even if they have already been vaccinated?
Yeah, actually, I get asked that a lot. And at this point, this is how I advise. And I know there are lots of other, there's lots of different medical professionals and they all have their own advice. But
Right.
This is what I advise people, is that there's a lot of data out there that's available that can show you where there is a lot of disease activity and where there's not a lot of disease activity. And every individual person has a different set of health conditions, different vaccination status, different family makeups, ages, older, younger, and every family is different. And so right now, what I advise people is that when you're getting ready to travel, do some research into what is going on in the area, because what is a hot spot today may not be tomorrow, and a place that doesn't have a lot of disease activity right now might next week. And so it's really important to do that research before considering traveling, to weigh all the factors, and maybe even check with your doctor, say, hey, my family's dealing with this, this, and this. We want to go here. Do you think that's safe? Rather than avoiding going anywhere or just freely going everywhere. I think we have to make those informed decisions about what we choose to do on an individual level.
Okay, that's fair enough. Dr. Sears, this is something that we don't like to do, and that's, be concerned about our health as far as internal is concerned. So now I know we have discussed on the show previously in regards to how these variants can be able to attack our inside organs as well. So talk to us a little bit about the contamination part. I know we said something about earlier that it's here to stay. So what we're saying is, there's not going to really actually be a cure to this. It's just we're going to have to take precautions and measures so we can perhaps prevent from getting it.
Well, the answer is correct. And our number one preventative is a strong immune response. And because these mutants, we keep multiplying, and each corresponding vaccine becomes less and less effective. So rather than saying, hopefully it's the biotechnology industry will save us with a brand new vaccine, we want to look on the other side of the coin. What can we do from our own internal standpoint to basically increase the effectiveness of our immune system to basically spot new pathogens and develop the appropriate responses to those? And this is one of the biggest problems we have in America, is that one of the best ways to depress your immune system is to carry excess body fat. Why? Because excess body fat is inflammatory. And therefore, if you have inflammation, and COVID-19 is an inflammatory disease, and that extra inflammation will also depress the immune system. So if you think basically asking people to wear a mask is hard, here's a harder one. Lose weight. Because that's one of the best things you can do to enhance your immune function, because you're reducing the amount of inflammation in the body. So, and this explains to a great extent why we have a much greater amount of mortality from the COVID virus here in America than in other areas. Why? We are the most obese population in the world. So rather than basically saying, looking for the drug industry to save us, we have to put some skin in the game also, of saying, what can we do to basically increase our immune system? And it's not as simple as say, I'll take a vitamin D capsule. That's basically a pipe dream. What you really have to do is basically go back to the basics that your grandmother told you. And there's really three things. One, you eat your fruits and vegetables. I don't like that. But you got to do it. Two, your grandmother also said, take your cod liver oil. I don't like that. You got to do it. Why? Because the omega-3 fatty acids can be very powerful immune stimulants by depressing inflammation. And the other thing is saying, using common sense, whether you're traveling or not traveling, say, you should probably think about wearing a mask. I don't want to. So say, okay, basically, we found the problem. And it was like the great philosopher Pogo said, we found the problem, and the problem is us.
Okay, that's fair enough. So still with you, Dr. Sears. So why is it that if individuals, they perhaps maybe go to the physician, and of course I always go and get my checkups all the time. So the first thing the doctor told me said that if the patient has anything like high blood pressure, high cholesterol, anything, they are the first ones that are prone to catching these variants. And so could you explain to us, and I know that you were saying about the immune system and what have you, but I'm like, that's the first I guess, bracket of people that they were giving these vaccinations to was the ones that had pre-medical existing issues already. And then the ones that didn't, they were the ones that were on the back burner. I mean,
That's correct.
At least that's the way they did it in some of the pharmacies here in Tennessee.
And that's correct, because what you see in terms of those chronic disease states like hypertension, diabetes, heart disease, these are all inflammatory conditions. We talk about in terms of immunometabolism. Basically, our immune system basically is controlled by our metabolism. And when we have dysregulated metabolism, all of a sudden, a number of chronic disease states begin to emerge. There's a generalized condition called insulin resistance. And people say, I don't know exactly what it is, except that virtually every chronic disease state we experience in medicine is somehow associated with insulin resistance. A good way of looking at insulin resistance, your metabolism is not working as well as it could. And that means your immune system is not working as well as it could. So we come back to basically that, how do you basically jack up the immune system? You've got to get your metabolism become more effective. And without that, you're going to be up the creek without a paddle.
Oh, wow. Okay. So we're going to put a pin in that, Dr. Sears, because we're going to go to Dr. Raina, but I want to ask the next question after I talk to Dr. Raina as to how did it shift? Okay, it went from the adults, and then in America, we saw where it went to the children. It was a big fiasco about that, about the parents, their religions and all of these other things and what have you. And I think in some terms, the government can step in if it's a life and death situation to enforce the parent to be able to get this. So that would be another question. I want to put a pin in that as to how did it maneuver from the adults, then it came, and then it froze for the children, but it went to the adults, then it came all the way back around to the children, and then the school systems it was a school system here in Tennessee where they went in and just shut down the entire district. They set their district down. So just hold that thought, and I'm going to come back to you, and then we're going to talk to Dr. Raina as to how many of the cases and the increase of these variants that he is seeing also in India where he's at.
We do see variants, and we have seen a new variant as well, something that has attracted the attention of the people at a large across the world. But the number of cases that we are seeing at this point in time is around 18,000. And this has stayed something like this for a long period of time now. We have not seen a huge surge of cases for a long period. In fact, we started stabilizing at around 9,000 to 10,000. And since then, we have sort of stayed at that level, maybe 11,000, 12,000, and it again gets back to those 10,000. Last night, I checked it out, it was 18,000. So we have more or less stabilized at this number. And at this point in time, I don't see a huge surge happening across the country, because of the fact that what I was anticipating is that there are few parts of the country which are reporting more number of cases, and those parts of the country are already peaking in terms of the number of the cases. Okay. The primary reason for that probably is because of the fact that Indians have more of a hybrid immunity at this point in time. So we have most of the adult population covered through vaccination. In fact, 95% of our adult population is covered by vaccination. And those who have not been covered by vaccination are mostly infected. So that hybrid immunity is giving us a protection as far as newer variants are concerned. This may not work very well with other variants that may come up, that may be on the anvil for future. But at this point in time, they are giving us some amount of protection. Maybe because of the fact that the first to strike us was Omicron BA2, and that BA2 is more protective against BA4 or 5, something like that, or the other way around. So the fact that we have been infected to a large extent, and the fact that we have been immunized to a large extent, may be something that is protecting us at this point in time. It may not stay the same. It may change anytime because of the fact that it is that, as you say, it's a cat and mouse game. At this point in time, we are winning, but tomorrow it may be the cat again. It may again be the COVID-19 pandemic, which may win with newer variants of Omicron or entirely different lineage variants that may come up and screw the system itself.
Okay, so still with you, Dr. Raina, we know that there were some cases, though, that rose in China. This is actually where it started from. So And I think about a couple of months ago, I don't have my facts in front of me, but I think a couple of months ago, I did see an article in China where it was the variants were just getting out of hand and what have you. And so the reason why I'm asking you this question, because you're a part of the World Health Network. So why were they were putting up barriers in front of the people's houses in China? They were putting it up. They could not go anywhere. Of course, America, we're not doing that here. So, do you think that would be a better solution to reduce the COVID, that type of variant from spreading? It was about a couple of months ago. They were literally, actually, they were going around nailing them in bars, putting it up in front of the doors in the country of China.
Yes, this was somewhere in Shanghai. I don't endorse that view as far as what they did in China, but we need to realize a few basic things. One, infection anywhere of COVID-19 is going to be infection everywhere.
Okay.
The best way to tackle it is to have a geography and time disconnect. What do I mean by that geography and time disconnect is that if my numbers, as far as US is concerned, I can see at the US numbers, I don't think that we have seen a dip in numbers for last 2 years as far as US is concerned. Since I would say March 2020 till the June of this year, the numbers have more or less stayed at very high numbers. They have not reached, I would not say zero, but they have not reduced to an extent when I would breathe easy and I would say, look, I'm able to take care of it. The best way to tackle this pandemic is to arrive at numbers which are geographically disconnected. So we may have 3 or 4 or 10 cases coming from one part of the country, 3 or 5, 10 cases coming from another part of the country, and then we have another outbreak at some other part of the country. And then there's a time gap between them. As long as we are geographically and time connected as far as this pandemic is concerned, we are in a problem. But what China did may not be the best way to approach it. The best way, as I said, is to put in place all public health measures, including surveillance, better quality surveillance, very well informed citizenry who are willing to come forward and talk about their issues. Now, what I'm realizing even in India at this point in time is once the default setting for COVID was changed, if you look at the first part of the pandemic, the default setting for pandemic was death. So we will tell people, look, if you are able to save death, you have won over the pandemic. So go get vaccinated. Now the default setting for this pandemic is not getting hospitalized. So you tell people, look, this is not causing hospitalization. So it is all very fine. So since the default setting has changed from death to the fact that it's not causing hospitalization, people are not taking tests. We need to encourage people to take tests. Even if you have a flu-like symptom, your chances of picking up COVID are high, and your chances of transmitting it to someone else are again high. And as Dr. Sears pointed out, I may be fit, my immune system may be working well, but the guy next door with whom I interact maybe not very fit. He may be obese, he may be elderly, his immune system may be poor, but I am transmitting a very gentle virus to him, which may be very harmful for that person. So in that sense, people need to be made aware of the fact that, look, the infection is here. And every time you come up with a symptom which is suggestive of acute respiratory infection, you need to isolate, need to talk to the authorities, because we are still in the midst of the pandemic. That's how China should have dealt with it. China should have allowed citizenry to come up and talk about their symptoms. Let them be dealt with in a proper public health way, not in terms of enforcing it. Because the problem with that approach is that you will start missing cases. Then people may not report to you. People may continue to stay indoors. The deaths may happen not because of the fact that they were very sick, but because of the fact that they didn't get any kind of care. So in that sense, that may not be the correct approach. The correct approach is to follow the public health approach as far as this pandemic is concerned.
Absolutely. And I'm going to put a disclaimer on this because I'm not judging the methods of China. It's just, you bar them in, and they didn't have a choice, period. They did not have a choice. The United States, we have a choice and whatever. I'm pretty sure people will go out and they'll protest, and they probably break out the windows and get out anyway if they did try to bar them in. But I was just concerned about that as to the authority that they had over them. And I know that they were trying to prevent the variant from spreading, but just nailing them in. I thought that was kind of, I don't know, it was a little extreme. So Dr. And thank you so much for that, Dr. Raina. So we want to talk about how the variant goes from one age bracket to another. Even though the parent is staying in the same house with the child, first it started off with one age bracket, then they said it was the senior citizens. And I understand everybody don't know everything because everybody is trying to still do research, trying to get to the bottom of it and trying to find a better resolution for everybody as to how to tackle it. Even though it's going to be around, it's probably going to be like the flu epidemic that, we have to go in and get a vaccination for that once a year too. But I guess I was concerned as to how it started from the one age group and then it went to the children, because like I stated, some of the schools here in Tennessee, they were quarantined the entire district. Once it was like 5 of them got it, they just shut the whole entire district down. So I guess I was just concerned as to how it perhaps maybe stayed with one age bracket for about 6 or 7 months or maybe a year. Then all of a sudden it just started moving to the children's side.
That's for me?
That's for Dr. Sears.
Well, part of it is part of the mutation. The initial of COVID-19 was not quite as infectious as now these new mutants are. These new mutants are much, much more infectious. So that now you have, but they're less lethal. So the good news is we have less deaths, but we have something that's almost as infectious as measles, which is the most infectious virus known in the medical science. So we're seeing basically as the virus mutates, becoming hopefully less lethal, it's also becoming more infectious. And therefore, basically, for children who have a relatively strong immune system compared to adults, now this increase in infectivity is basically giving them, again, greater of likelihood of being infected. Therefore, I think we're seeing, and this happens to all viruses. Initially, they're very lethal, and then they become less lethal, but they're looking to live. So they say, I want to infect as many people. I just don't want to kill the host. So this is actually, in many ways, I think, a good sign that we have a less lethal virus as it mutates.
Okay, great. So, and thank you for that, Dr. Sears. So, Dr. Purdy, here in Tennessee, what are some of the elements that you're saying that, some constructive ways as to what we can be able to do better, in, I guess, and I know it's hand washing, making sure your hand, but Tennessee has a very, we feed lunch. The children get lunch, breakfast, dinner, or what have you, but then they pass around these carts with sausage and biscuits, pizza, all kind of things like that. And we're still talking about the internal, which, Dr. Sears have already, brought it to us. Those things can create issues, medical issues. We have a big obesity rate here in Tennessee, especially with the children. So what are some of the other constructive ways that we can be able to do? I know we're talking about it today, but this is on a global level that we're talking, international level that we're talking on today. But I'm talking about as far as certain jurisdictions. What can certain jurisdictions do to be able to bring more awareness to the public about what they need to do, especially when it comes to our internal organs? If this intact, if our immune system is not up, then guess what? We can have all the vaccinations that we want. We're going to get it anyway.
Yes. So I work in a hospital here in Nashville, and I'm out, I'm out in the community. I see people, I talk to people, and I agree with you. In Tennessee, we've heard a lot about, the masks were really controversial. The vaccine was very controversial. Closing, everything that has happened in the entire pandemic in Tennessee specifically has been so controversial. But
people got fired.
I mean, yeah, it's getting fired and schools closed, riots. I think I saw there was like a riot at the school board one time, and there's just, it's been really, aggressively controversial in Tennessee. But I actually was doing shifts at a hospital here in Nashville in the later part of the pandemic, and us internally, we were doing our own studies, and the data was showing exactly what Dr. Sears was saying, that if we had a patient who came in with this, and this, health condition that was ultimately related to obesity, we could almost, like if we had a crystal ball, we could predict what the outcome of that patient was going to be, because it became so predictable. And so in the hospital, it is something that we talk about, but I haven't heard it talked about in the community. I don't hear, unless I've missed something and you tell me
you're right.
Unless I've missed it, I have not heard, public health officials, the health departments, the local authorities here in Tennessee telling people, let's talk about, weight loss options. Let's talk about getting blood pressure down. Controlling our diabetes is huge.
Absolutely.
Uncontrolled diabetes, which is really tied to the obesity epidemic that you're talking about, just annihilates somebody's chances of having a favorable outcome from having COVID. And so I agree with you. Awareness is the key component that we're missing. It's not being talked about, not even in a place like Tennessee. And I don't know what the other states are doing, but I would make an educated guess that it's not being done there either, because that's the thing that people don't want to talk about. It's the unpopular opinion. But I think we owe it to our communities, and we owe it to our patients, and we owe it to our parents and our everyone, to provide them with this education and this knowledge that, just like Dr. Sears says, the first thing that we can do is we can help ourselves by getting our bodies and ourselves ready for these infections, which are more infectious, right? And infecting more people. That's the first place to start.
Absolutely. Now here and around in our neck of the woods, Memphis or what have you, the John Hopkins report has been showing a lot. And so people have been in a lot of controversy about that. And as you stated, Dr. Purdy, we was talking about that a little bit earlier and things in your statement. A lot of people's heads rolled in the state of Tennessee. As soon as that John Hopkins report came out about the variants increasing and all of the people, perishing and what have you, there were people at top levels in the state of Tennessee. They lost their jobs and what have you. And some individuals are still in some legality, trying to retrieve their jobs back. So I think that is very, very important. I'm just not understanding why we're not clicking with the communication, why we're just, and then when Dr. Fauci tries to talk, then the people tries to close him up. They don't want him to say anything about it and what have you, because people just want to, be left alone and what have you. But the problem continues to exist. Like I was sharing the example at the top of the hour about the cemetery. When I was a child for 40 years, that cemetery has never been full. But since this Omicron has came and all of these other coronavirus, these variants have came, now it's full and they have to purchase more and more property because they're putting and running more people in the ground. And that's kind of, a little sad because we're not making enough awareness. There's not enough awareness. So thank everybody for that segment. We want to go to the monkeypox. We want to talk about that. And we're going to start with Dr. Raina, and as to what he is seeing in India, because it's very, very important. That's the reason why I make sure I choose my panel properly, because every jurisdiction is going through different elements and they have different information. So we want to start with Dr. Raina to get some elements about monkeypox, if he's seeing that in his location.
Yes, we did see. We have, at this point in time, we have 2 cases of monkeypox, and they have been reported from a single state. It's the Kerala state in the southern part of India. And the first case was reported probably on the 14th of July, and after 5 days, the second case was reported. Now, the first case was a traveler who had traveled from the Middle East and was a foreigner, and he had traveled and had reported this monkeypox. The second had a history of travel. He had also traveled to the Middle East, was a native Indian, but had a history of travel to the Middle East and had reported back to his native place, and he was spotted with these symptoms. And he was, again, both of these patients have been admitted in a health facility and are recovering well. We have not reported a death at this point in time, just 2 cases, and that's all we have in India at this point in time.
Okay, Dr. Purdy, what have you seen in regards to monkeypox? And then also, if you would define monkeypox to the audience, if you would, what monkeypox is.
Yeah, so monkeypox is a virus, right? It's actually very similar to smallpox. If you've ever heard of smallpox, and it actually looks and appears to be similar to some of the other viruses that we're familiar with, like chickenpox, right? So you can get almost like ulcerated, crusty kind of skin lesions. I get almost every day, it seems like, updates from various medical boards about what their states are doing with regard to monkeypox. And so they talk about looking for unexplained flu-like symptoms, which could be fevers, chills, body aches, all those non-specific strange symptoms. And then of course, the rash. And so it can be mistaken with things like shingles, herpes.
Oh, wow.
Yeah, because they can be blistery, they can be crusty, and we haven't seen monkeypox before. So
Right.
it can be mistaken for, in some patients, it can be mistaken for STIs just because of where it's located. It can usually be in the genital region, in people who've had recent sexual encounters. And so it's been mistaken for syphilis, it's been mistaken for herpes. And I personally have not had any patients come across my desk that have had it that I know of, but I have seen patients who have brought to me some skin lesions that have ultimately turned out to be shingles, but have caused me to take a second look, ask a few more questions, say, where have you been? Who have you been exposed to? What other symptoms do you have? And so it is here in the US with a higher prevalence than what Dr. Raina was speaking of in India. It does have a higher prevalence than that. I don't know the exact number, but we definitely are seeing some cases here.
Okay, great. So this question is for Dr. Sears. Of course, you deal with the internal and what have you, and some children, I'm pretty sure monkeypox is dealing with children more than it is adults, I guess I would say. I'm not for sure. You're all the experts. So the question is for you. So if a child gets this monkeypox, and just take for instance, if they already have one of the variants, how can that affect their internal immune system?
Well, if you're getting multiple infections from multiple viruses, that just puts an overload on the immune system. To my best knowledge, at least as of yesterday, there have been no deaths from monkeypox in the United States. So therefore, we're saying, we think of monkeypox, as correctly pointed out, say it is of a relative to smallpox. That's dangerous. But monkeypox seems to be far less virulent. But it's a concern because, again, is that unlike a COVID-19, where your incubation period and period of being able to infect others might be 10 days, with the monkeypox is closer to 4 weeks. So if you're having trouble getting people to isolate for 5 or 10 days, ask people to isolate for 4 weeks. Not going to happen. Yet, basically, during that time period, those scabs, as they're basically forming and falling off, they become now new vectors to basically spread the monkeypox. Fortunately, this form of monkeypox is not very lethal, but it is a concern because you're putting a greater burden on the immune system that makes you less likely to be able to fight off any other infectious insult to the body.
Okay. So still with you, Dr. Sears. So here in Tennessee, we have a program. We have several programs for people to be able to eat healthy. People are just not taking the initiative to follow through with it. I think it's plate.gov is one of them, where individuals they can go there on the site, plan their meals every day and what have you. So do you think that will kind of be even more better to be able to reduce some of the things that we go through on the internal organs? Because that's a step to it, but if we're not talking about it, that's going to defeat the purpose too. We still, just like Dr. Raina said, collaboration, awareness, we talk about it. So do you think that will be even more helpful for us to be able to do that? We can be able to go in there and plan out our meals. If we don't like asparagus, we still may have to eat it in order for our immune systems to be a little bit, a little bit stronger and greater. Because I know this one lady, I'm not going to use her name, but I'm going to use her as an example. She's about 75 years old. For the last 25 years, she's repeated the same thing. She gets sick every month of January for the last 25 years with the same issue over and over and over. And so I went to her because her immune system is so low. I went to her and I told her, I said, these variants, they're increasing. You need to watch it. And she's still out working and all of these things. And so I guess that would be another question. How can their body be that immune where it comes every time, every January, she falls into the same situation? It's almost to the point of death. For the last 25 years, it's been going on. And that's been what? That would make her 55 and she's 75 today. She goes through the same pattern every January. It's always something going on where it comes in and it pulls her immune system all the way down and puts her at a death status.
Well, this is why we have a dichotomy in the United States. We're focusing more on the immune system and really the metabolism of the immune system. So rather than telling people how to make good meals, and we give billions of dollars for free vaccines, it makes a lot more sense to me to take those people who are at high risk and say, we're going to give you free fruits and vegetables. Why? Because if you always eat free foods first before you basically eat foods that you have to pay money for.
Right.
And at the same time, we're going to give you free cod liver oil at the same time. So we would give much greater return on investment of saying Operation Warp Speed, say biotechnology will save us. No, what will save us is a strong immune system, which is controlled by our metabolism, which is controlled by our diet. So unless we want to start putting our money where our mouth should be, and rather than putting in high-tech aspects, which have not a great track record in COVID-19. But again, so rather than say, here's how you make me food, say, here's the food. And therefore, I think that will have a greater return on investment than any type of, quote, breakthrough in biotechnology.
Okay, absolutely. So we're going to stay right there. We're going to stay right, and then we're going to come to you, Dr. Raina, but we're going to stay right there with you, Dr. Sears, for a minute as to the elements of cod liver oil. We don't like that, of course. And SS tonic, that's something that I kind of took when I was a child too. So kind of share with the audience a little bit about that, about the elements, and what does the cod liver oil do to the internal, to be able to build it all the way up, because we got these other, I think it's airborne. I think it's something that they give to children as some sort of immune system booster or something like that. So tell us how effective that the cod liver oil will be versus over the over-the-counter drug, or, well, it's not an over-the-counter drug, but you can purchase it at the Dollar Tree or something like that. But it's supposed to have some sort of factor where it boosts the metabolism or the internal organs up. So tell us a little bit about the old system of the cod liver oil.
Well, the old system basically is based on science. Cod liver oil was a primary source of omega-3 fatty acids. We need about 2.5 grams of omega-3 fatty acids every day. The average American today is consuming about 100 milligrams. Now, why is this important? The omega-3 fatty acids are the building blocks of a powerful group of hormones. They're called resolvins that shut down inflammation. There is no hormone, no drug that holds a candle to these resolvins, but you cannot make them unless you have adequate levels of these omega-3 fatty acids in the blood. If they aren't there, you're basically up the creek. So again, this is why, going back to why every child 3 generations ago could not leave the house before they had a tablespoon of cod liver oil. They thought because it contained vitamin D is preventing rickets, but actually the benefits was it containing omega-3 fatty acids that would basically give another strong boost to the immune system of reducing inflammation, and it's excess inflammation that basically decreases the efficiency of our immune system.
Okay. It
still tastes terrible, but the fact is, the science behind the omega-3 fatty acids is incredibly robust.
I'm gonna pick some up today. I'm serious, but it's yucky, just like casserole.
That's what you call tough love.
Okay, that's fair enough. Wow, it's okay, and that's just something that we have to do, because if these variants are still increasing, and we're getting the knowledge here today as to how to reduce some of these things and these infections have come into our bodies. Our bodies just not in some of our bodies, not everybody. I know there are individuals that they work out, eat well, and what have you, but I guess what I'm saying is there are some that do not. So we're going to share this. I'm going to go get me some cod liver oil today. SSS tonic too, because I know that's an iron booster as well, and it's yucky as well. But I guess the bad things that taste so bad, that's what's good for the body. So thank you so much for that, Dr. Sears. So Dr. Raina, so being a part of the World Health Network, what are some of the strategies, if you can discuss that with the panel today and with the audience? What are some of the strategies that you all are making to be able to help improve individuals, not just in India, because World Health Network, that's a global thing. So what are some of the strategies that your panel or your group is doing to be able to help individuals to bring more awareness to this?
Look, we need to understand, we need to put monkeypox in the correct perspective. If you look at the history of monkeypox, monkeypox, for most part of the last century, it stayed in Africa. It didn't come out of Africa. So it was only in the beginning of 2000. In fact, 2003 was the year when it moved out of Africa for a large part and did cause a small outbreak in the United States. In the year 2018, we did see a few cases of monkeypox in UK. In fact, 2 or 3 cases of monkeypox in UK. So it has largely stayed in the African continent, and within the African continent, it has stayed within the African rural areas. It didn't move out even from the African rural areas to the African urban areas. The first transition that happened in monkeypox was it moved from the rural to the urban areas of Africa, and from the urban areas of Africa, it moved across the world. The one critical point for its transmission was travel. As you saw, with the increase in travel, and we have seen that this happening over a period of time. Absolutely. Since 2008, we have basically crossed that critical threshold for travel for pandemics. The amount of travel that we are doing now is way beyond what could have happened maybe 10 years, 15 years back. So once the travel started increasing, it moved out of Africa. And because of the fact that last 2 years of COVID-19 put people into isolation, put people into a situation where they didn't move a lot. So post-COVID, what happened was the activity started increasing. People started moving together. They started celebrating together. Social events started happening. Plus the travel that has happened from and out of Africa is something that has caused this pandemic to happen. So we have a huge number of cases of monkeypox at this point in time. If I check the records correctly, US has around 2,000 cases of monkeypox. So that's huge enough number. The last time I checked was, as I said, 2003. It was 73 cases of monkeypox. But the fact now monkeypox is more or less entrenched in our system. We need to understand it. The best way probably to tackle monkeypox again is to create awareness. You need to tell people, look, this is an infection that may be around us, and this doesn't need to go to the adults only. This also needs to go to the children as well. We need to tell children as well. Look, this is something that may be around us. These papules, these macules, vesicles, pustules that appear very innocuous may be a feature of monkeypox. Somebody presenting with fever with any of these. The classical finding that should be looked into is the lymphadenopathy, particularly around this area. So if you tell your people within the schools, or if you tell people in the community as such, look out for these symptoms. If anybody has lymphadenopathy with fever, with these rash, or with these papules, macules, he or she should get himself tested, as well as the fact that he or she should isolate himself. Because you look again, the transmission is human to human. So unless and until we are able to break the chain of transmission, Dr. Sears said it will be difficult for people to isolate themselves for another 20-24 days, because the incubation period is roughly 4 weeks. So it may be difficult for people to isolate, but that's the only way out. You don't want to transfer the infection to a young one, because if somebody who's an adult picks up monkeypox and transmits it to his young one, to a kid in the family or around him, the chances of severe form of disease, mortality is higher in children. So infecting a child who may pick up a severe form of disease, and then mortality may set in. Fortunately, at this point in time, we don't have huge amount of infection in children. We have largely infection which is largely in the adolescents and adult population, because of the fact that they socialize together, and wherein it is at this point in time. But it is no point where it may move again to the younger kids, and then the fatality will set in. Another advantage that we, at this point in time, we have is that the variant of monkeypox that is among us, even in US or most parts of Europe, at this point in time, is not as severe as the other variant. We have the Central African variant and the Western African variant. So we have at this point in time a variant which is slightly milder, but you never know because of the way we are traveling. As I said, you may have the other form of variant, and then the mutations may happen because at this point in time the infection is largely restricted to humans. So there may be a point when humans may transmit it to the animals, and then it may continue to circulate in the animals and then start infecting humans again. So a circle may be established, human to animal, animal to human, and that's where we need to be worried about. So it's, at this point in time, the best way is to talk to people, encourage the governments to talk to people, spread communication. Communication is probably the key as far as monkeypox is concerned, because monkeypox is not as contagious as COVID is. COVID spreads much faster, much rapidly, and than monkeypox. So it will be much easier to tackle monkeypox than COVID if we are able to communicate well. Probably communication is the key as far as this pandemic, this monkeypox is concerned.
Wow. Okay. So monkeypox. The variant is faster than the monkeypox. Okay. That's fair enough. So this question is for Dr. Purdy. This is going to be the last question. And so this is in regards to, I'm the type of person, I've always thought about the what ifs. Okay. And I know we don't know how to do that in America about the what ifs, because once something breaks out, then we think about, everybody is in a panic. They don't know how to, become organized over a situation that perhaps maybe, we have always had stuff that go on in the United States, bubonic plague, the swine flu, and all of these other types of diseases that have been an outbreak in the United States. So what if, we're going to take a scenario, what if it broke out in Tennessee? Are there any precautions that are set up to be able to come in and say, okay, then we got this? If it's the monkeypox, if it's the B4, B5, are there anything that is set up in your jurisdiction to say, okay, we already know how to handle this? Because like I said, like Dr. Raina was saying, there's not enough of communication. We're not talking about this enough. We're more concerned, okay, that's happened, to 2020, 2021, everything is over with, it's done with, and then here comes another wave of it. And then the people, they get angry because it's coming. They get angry because the variants are mutated. They don't want to hear anything about it. I'm surprised that Dr. Fauci is still, I don't know, because they were very, very controversial against him. So are there, what if this variant would break out? Are there any elements that Tennessee has that say, okay, then this is what we're going to do? And then we're going to ask the same question for Dr. Sears too, after you get through responding, because he's from the state of Florida. Okay, go ahead, Dr. Purdy.
Great. So I really think it's very important to re-emphasize what Dr. Raina just said. Monkeypox and COVID, not the same thing, right? So monkeypox is a totally different type of virus. It has completely different behaviors in the way that it's transmitted, in the way that, in the, like some of the words that Dr. Sears has used, the virulence is different, the infectiousness is different. And so all of the principles and the things that we thought about the way things worked during COVID are essentially irrelevant and don't apply when we think about a what if, because, so just to give you a concrete example, right? A large majority of the cases of monkeypox have been seen in sexually transmitted interactions between certain types of people. So you have to really, I don't want to say you have to try to get it, but it's not as simple and it's not as transmissible as, shaking hands with somebody or being in a room where someone has coughed who had monkeypox. Really, these are, I was just reading it this morning, right before I came on, and it says, most cases have been identified with certain types of sexual encounters, right? And specifically, it will say men who have sex with men. That's what's being said in the reports. And so how do we control an outbreak of something that is largely transmitted by sexual activity, right? So So community-wide, I don't know that it would ever get to a point with what we're seeing right now where it would be necessary to implement community-wide measures to keep people from spreading that type of infection, right?
Okay.
So that's totally different than the COVID strains. If monkeypox mutates and now people are getting it from shaking hands and from coughing on each other and from being in close contact, that's a completely different conversation. But that's also not the monkeypox that we're seeing right now, thankfully. You know, for the COVID strains, that's a different conversation, because like Dr. Sears has said a few times, the more we as a country get COVID, fight off COVID, have immunity, and then the strains mutate to become more infectious, which means it's easier to spread, but also less virulent, which means it's less likely to kill you. You know, here's what I tell people about that is Ebola is really virulent. It kills everybody. The common cold is, you know, but it's also not very infectious because not everybody catches it, right? And then the common cold is not very virulent. It doesn't kill most people, but it's exceptionally infectious because everybody catches the cold. So my hope is that as time progresses, as we see more mutations, more variants, that it becomes more in the direction of the common cold type of virus. And I'm not sure that as a community, there are extraordinary measures that we would need to put into place, like lockdowns and you know, shutting down business and boarding up houses, like we mentioned. I definitely align with Dr. Raina's views on that. My hope and my thought is that those scenarios are so far from a reality of what would ever happen that we don't have to go there.
Right. Okay. I mean, I brought it up simply because of the fact that I just thought it was kind of extreme for China to make those decisions. And like I said, every country is different. They have their different policies and rules and what have you. And you know, they can't do anything about it. But I just wanted to bring that out, just to, you know, you just never know what would happen because of these variants. They continue to go on and on and on, and there is no end to them. And then they have different side effects. They have different elements to them. And so that's the reason why we want to talk to the, you know, bring the conversation up. So now I know that there's a difference between monkeypox and the Omicron and the B4 and B5. So my thing was on that question, Dr. Purdy, was just, you know, was there anything set in place just in case if something is an outbreak here in our jurisdiction? Like I said, sometimes we don't do anything until the last minute, until it's a huge, big thing. And then next thing you know, heads be rolling. People want to start terminating individuals and stuff like that. And it need to be a constant conversation. Someone needs to always be talking about it over and over and over because it continues to mutate. And so I guess that was just the reason why I perhaps maybe have applied that question here in Tennessee. We're kind of relaxed. This is a barbecue festival type of state. We eat and we get fat and we get big, and I think it's a lot of farming, a lot of agriculture here in Tennessee. So we're very, very laid back. We're in the Smoky Mountains, you know, and so I just wanted to kind of bring that up to kind of maybe shock everybody, you know, and put it out there. You know, these things are true. You know, these things can happen, even though China may be several thousands of miles away. But just look how it came to the United States just that quick in the presidency of former President Trump. I mean, it came just like that. So that's the reason why I always think about the what ifs as to what could happen and what we could be able to be taking, pre-measures that we can be able to be taking. So that's going to be the next question also for Dr. Sears, because he's from the state of Florida, and which has also been another state that's been controversial because there's a lot of beaches there. People like to get out. They don't want to be in. They want to travel. They want to do all of these things. So at the same time, you know, we're still going to put the what if out there. What if these things do come out and what have you? Are there anything like the medical platforms talking about what can we be doing down the road to be able to help people in the state of Florida so they can be able to be more and more aware?
Well, in the state of Florida, it's truly a laissez-faire, the fact that we have nothing in place. And therefore, basically, Tennessee looks like a medical center compared to Florida. And so far we've been lucky, but but being lucky is not a good philosophy going forward.
Okay.
I think we just have to go back to talk about public health. And this transcends viral infection. It transcends all of our chronic diseases that are crippling our healthcare system. Diabetes, heart disease. These are chronic diseases, but both viral diseases and chronic diseases, they have a common breeding area: increased inflammation in the body. That we can control by public health measures, primarily food. But say, it's impinging on my right to eat. Saying, whatever. But at least you're trying to get the point across. Say, our best defense is not basically building of a dam, but building basically a boat that we can rise. If the waters rise, we can just float away. So these things which we have, have put for the wayside because they're not friendly. But again, we basically have made ourselves an easy target for not only viruses, but chronic diseases. These are increasing at a rapid rate throughout our country. And we're going to bring our country to its knees because about 20% of our gross national product is spent on healthcare. And this is unsustainable.
Absolutely. So other things are going on too, because sometimes when it comes to, I'm not going to say that Dr. Purdy's on there, so this is a Tennessee state, so I'm going to keep that comment to myself. But, people are getting, I had to arbitrate something just not too long ago, with this medical practice and what have you. This is I guess a feasible thing for not for hospitals but for medical practices though. People are getting the money in there too, in regards to that. So this is just a conversation that needs to be continued over and over and over and over. And that's the reason why I continue to try to bring it up every month if I can, to be able to wiggle it into some of our other shows that we're having, because it's very, very important. People don't want to talk about it, but it's very important. We need to know what to eat. And I think this is 2020 to 2022. I think Dr. Sears, you had brought it up first on the first time that you was on the show about the cod liver oil. So today I'm going to get some. I'm going to get my cod liver oil so I can kind of work on I guess my immune system. Okay.
So just make sure you hold your nose when you take it.
I know. It's just so disgusting. So ladies and gentlemen, thank you so much for being a part, but we do not want you to leave the show without you sharing with the audience how they can connect with you, any books that you have published that the audience can read so it can be able to further their education in regards to any type of disease or any type of issues that may rise or perhaps maybe have been in the past. And then you can share your social websites, your links, and your website platforms. So we're going to start with Dr. Raina. If you would, talk to us about that and share that with us about anything that you would like to share with the audience as far as your social media platforms, websites,
As far as my work is concerned, there is a lot of research that I have done on COVID. As I said in my previous, that the initial part of it, most of it it's in public domain, and anybody who wants to reach out to me can reach out. So the best way to reach out to me is through my email, which is available with you at this point in time. And the other way to reach out to me is through the World Health Network, wherein I have listed the links are there on the World Health Network website, wherein I am listed as the advisor of the COVID Action Group. So anybody who wants to reach out to me, go to COVID Action Group, click Dr. Raina, and you will find me. Everything that you want to ask me questions in person, you want to talk to me, or you want to send me an email, I'm available.
Okay, thank you. Okay, Dr. Purdy.
There's a few ways to find me. So the best place is LinkedIn, Dr. Laura Purdy on LinkedIn. You can send me a message. I also actually have a virtual clinic. So if people want to become a patient or talk more about these things, you can search it on the internet, just Laura Purdy. The system is called Push Health. So Laura Purdy Push Health, you can actually become a patient of mine. Haven't written any books or anything like that yet, but stay tuned. I think that probably will be coming. Stay tuned. Yeah.
Okay, Dr. Sears.
They can go to my website at drsears.com where I talk about these concepts in terms of diet, the immune system, inflammation. And my most recent book, available on Amazon.com, is called The Resolution Zone, which basically goes in much greater detail of some of the concepts I've talked about today.
Okay, great. So audience, everyone, thank you for tuning in with us. And also we'd like to thank our panelists for being with us, for taking the opportunity to be with us. They have busy schedules, but we're so grateful that they took the opportunity to be with us on today. Meet us over to our next segment that's coming up at 11 o'clock or 11:30. We got another interview that's coming up, and so just meet us over there. And so for all of upcoming updates, you go to our website at www.womenwhorockWithSuccessMedia.com. Guys, thank you so much. Thank you. Have a wonderful day.
Thank you very much.
Thank you.
Bye-bye.
Thanks.